Hello again, everybody. This is John with BestPriceNutrition.com. Today I'm here to talk to you guys about Garcinia cambogia. It was recently discussed on the Dr. Oz show. I believe it was actually referred to as the holy grail of fat loss, and these are terms that we don't like to apply to supplements. They're kind of hyperbolic, especially fat loss ones, because in and of themselves nothing can have these miracle effects or things like that, especially in the context of when you're lacking, let's just say in the case of fat burning, a hypocaloric diet, in other words, where you take in less calories than you burn, and maybe throw in some exercise too. Those things are always going to make a fat loss supplement work better, and a lot of people are probably like, well, duh. But of course, it's just when sometimes these terms are assigned to supplements. I guess if you're on TV, you got millions of viewers, you got to say those things, but then we have to speak for the expectations that come when we get these questions. So we just want to give you guys some context and tell you what the research actually says about Garcinia cambogia, which is a tree that is native to Southeast Asia and West Africa, and it puts out a fruit that almost looks like a pumpkin. On the outside of it, the texture of it, it's about the size of an orange, or it could be as big as a grapefruit. And in the rind of it, there's something called hydroxycitric acid. That's the active ingredient from it. In the rind, it's about 50% hydroxycitric acid. When you're buying a supplement, you want it to have at least 50% hydroxycitric acid. A way to ensure that is to look for something called Super Citramax, which is a trademark patented raw material that guarantees you're getting at least 60% hydroxycitric acid in your Garcinia cambogia supplements. There's supplements by Now Foods, for instance, that we carry, and some other brands that are using this patented raw material. So it's a good way to make sure you're getting an efficacious dose of the active ingredient. Now, that active ingredient, hydroxycitric acid, plays a role in blocking an enzyme that plays a role inside the body in the biosynthesis of fat. And what you want to do is, if you take it, you want to take between 500 to 1,000 milligrams before a meal, about 3 times a day. You don't want to exceed 3 grams or 3,000 milligrams for the day. That's the dose that's been used in much of the research. And as I said, that effect is to block an enzyme that's going to play a role in taking excess carbohydrates and storing them as fat. So it's also going to play a role in how your body regulates blood sugar. It also raises serotonin levels. These are the purported benefits, which is what makes you feel good and makes you feel full. So some call it an appetite suppressant, is another effect that's assigned to it. Now the question is, what does the research say? Does it really have these effects? Well, it's kind of a little bit back and forth, because in the randomized placebo-controlled clinical trials, the results have kind of been inconsistent. Some have been really good, some have shown that it had no effect. And also the sample size is kind of small, along with the duration. There were no studies that were more than 12 weeks. One study showed that on average you were losing 4 pounds a month. The issue is, again, it was a small sample size, and that particular study was only 60 days. And the results, as we said, from study to study are kind of inconsistent, at least the ones in humans. So we'd like to see those randomized clinical placebo-controlled studies, we'd like to see them repeated and also done with a larger sample size and done for a longer duration, maybe 16 weeks or longer. See what kind of results we can get, see if we can get those consistently replicated. Now, that being said, there does seem to be some promise as far as with the ingredient's ability to burn fat. Now, the question we get is, can I take it with other stuff? Yes, you can. It's a non-stimulant. So maybe if you want to take it with your coffee, which has caffeine in there, it's fine. It's not going to have any effect. If you want to take it with something like green coffee bean extracts, Vitol, for instance, you can use that. Raspberry ketones, green tea extract, another appetite suppressant, saffron. These are other things Dr. Oz is talking about. You can take these together. It's fine. There's not going to be any antagonistic effects. You don't have to worry about it. It's really the stimulants typically you want to be careful with. Now, somebody who shouldn't take it would be a pregnant woman. There's no reason to try and lose fat when you're pregnant. You're trying to keep the health of the fetus up. Nursing mothers, we don't have any data to show the effect that it has on breast milk, so you may not want to be taking it during that. If you do, just be sure to discuss it with your physician, see if they even know. I doubt they'll even know. Or if you're just dead set on taking it, we'd recommend pumping and then maybe taking it, so that if it does leak into breast milk, it's less of a concern there. But that would be our advice, is to discuss it with your physician. And anyone on a cholesterol-lowering statin drug, you should definitely avoid it. These drugs are notorious for having antagonistic effects with other ingredients. You can have a lot of muscle cramps, things like that. So just avoid it altogether if you're on those, or at a minimum, discuss it with your physician. Also, they're really bad for you too, so I'd recommend seeing what you can do to get off of those, but again, discuss that with your physician as well. Also, diabetic drugs, since it does have the blood sugar lowering effect, it may very well work very well with them, but it would be best to discuss it with your physician to see if these can work in concert together. Again, we're relying on some little bit of inconsistency in the results, so we'd like to see some of those repeated. It can be used, though, for anyone who's otherwise, say, healthy, Totally fine. You can use it. Just use it as directed. Again, we're talking about between 500 to 1,000 milligrams. Some of them we sell at like 750, which is fine. You take one of those before a meal. And don't go over 3,000 milligrams or 3 grams per day. Again, Now Foods is a company that is using the Super Citramax. We sell that one. And there are other companies that do use this trademark patented ingredient as well. So you know you're getting an efficacious dose of hydroxycitric acid, which again is the active ingredient found in the rind of the fruit of the Garcinia cambogia plant. Who's going to benefit the most is going to be somebody who's overweight or pre-diabetic, because it's going to help you control your blood sugar levels. If you're somebody who's got those last few pounds to lose, it may not be as effective in the sense of helping you control your blood sugar, because you really probably don't have a problem with that. You're probably pretty sensitive to insulin, so you don't have that problem. However, if you do have a problem with binge eating or emotional eating, the serotonin elevating effect may help you, so that may be an area where you can benefit from it as well, or if you're just an emotional eater. So that's who can benefit from it.